Good morning and welcome to your Weekend Healthy Chat. I'm your host, Dr. Sara, and today we have another exciting show for you. On our show, please join me in welcoming Jeff Reilly, who's the Senior Vice President and Administrator at Secours Community Hospital. Good morning and welcome.
Thank you very much for having me.
Well, we're very excited to have you, so let's get started. I know there's quite a few topics we wanted to discuss today, and I heard that we're expanding the GYN services at Secours. So can you tell us a little bit about that?
Sure, yeah. We've been working in the community for a while, trying to recruit more specialists to the area to provide more services for the community, and we've been very fortunate working with Middletown Medical, and they have agreed to bring on a GYN surgeon to Secours Community Hospital. So we're hoping that Dr. Jean Louise will be starting to do surgeries at Secours Community Hospital in late January, early February. And we're going to continue to expand those services and offer more women's health options right in the community. So we're very excited about her joining us.
Okay, great. And would it just be GYN surgeries? Is that what
Well, her specialty is she's an OBGYN, but she's just doing GYN surgery at this point. So the plan is that she'll have an office in Middletown. She'll have an office on Canal Street in Port Jervis. And she's going to share an office with Dr. Hassan out in Milford. So she'll be seeing patients in Milford.
She'll be quite busy at 3 locations.
Yes, we're hoping very busy. So, there has been a GYN surgery void in our community for the last several years. And so most of the people that live in this community have to leave the community to get those services. So we're hoping that with Dr. Jean Louise, we'll be able to keep those people at Secours Community Hospital.
Try to bring some of it back to our community.
Correct.
No, that'd be great. So I know we were talking a little bit briefly about adding some outpatient sleep labs. So what is that?
Well, we have a sleep lab currently in the hospital. It's a 2-room sleep lab, and we provide sleep studies. Volume is pretty strong, and in the communities, it's a growing national trend. Sleep apnea and the problems associated with sleep disorders and obesity, and the increases in obesity in our communities. So we have been providing that service in the hospital for quite some time. Hospital-based services for those kind of things are not the most easy to access, always driving to the hospital, finding a place to park, going into the hospital, and through that whole process. So we had last year expanded and opened up a brand new sleep study lab in Warwick, and actually it's in the town of Florida.
Oh, okay.
So St. Anthony's opened up an outpatient sleep study, and as soon as we opened up that facility, they doubled their volume.
Oh, wow. That's great.
And so we've been working on a space on Canal Street again in Port Jervis. We are very close to completing that, and we anticipate over the next few weeks or so to get our Department of Health inspection. And then we'll be providing outpatient services for sleep studies at a remote location, easy
That'd
parking.
Be great, right.
You can come in, brand new renovated space. The space that we're renovating looks fabulous. It just came out really, really nice. So it's kind of a homier atmosphere. Easier for people to get comfortable, fall asleep, and
it's better in an outpatient setting versus the inpatient setting.
Correct.
Just being a person in the community, it'd be nicer to have something outpatient versus having to go through setting up in the hospital and all of that.
Correct. Yeah, and so the whole concept is these outpatient services. You design these spaces so they're very much like your own bedroom.
Right.
You have
otherwise, who wants
really
to
nice
sleep
services.
in the hospital?
Yeah, you're right.
Yeah.
You're right. So
it's not the best setting.
Right. And so under your specialty, Secours Community Hospital does not provide sleep study services for pediatrics.
I know.
It's a very specialized, unique kind of service. However, at St. Anthony's, at the sleep lab in Florida, New York, they do have pediatric sleep studies.
Oh, they do.
And we actually have a specialist, Dr. Traeger from Westchester, who does the reads and interpretations on those sleep studies. And we have specially designed rooms for rooming in, so family members can bring their children, and the parent can actually sleep in the same room with that child while they have the sleep study. So again, as we proceed along with the health needs of the communities, we've seen a lot of now sleep disorders that are starting to develop with children.
Absolutely. The amount that my partner and I refer on a regular basis. I mean, it's just even just something as simple as snoring.
Right.
Yeah. So it'd be nice to have that available in the community. And even as just to have it at Warwick is great, or Florida. Yeah.
I know it's a little bit farther of a drive, for people in the Port Jervis.
That service is now available. And how long has that been up and running?
We actually opened up the sleep lab offsite in January of last year.
Okay.
And so we had been providing pediatric services prior to that, but with the new site, having specialized rooms and the ability to have this rooming in capability with parents, the pediatric component has really taken off. So we're really starting to see a lot of pediatric cases there. So it's nice.
Are we hoping for that for Port Jervis eventually?
Yeah, we've been actually in conversations with Dr. Traeger, and he just added on a new partner. And so hopefully with a little bit of luck, we can continue to work with him and maybe at some point down the road be able to provide that service in Port Jervis. So we're looking forward to that.
No, that's great. That's great. I know we also wanted to touch base a little bit about the renovations that recently happened within the hospital, talking about the medical surgical floors. Do you want to discuss that a little bit?
Sure, yeah. We were very lucky we applied for grant money through the state of New York, which they call the HEAL grant. And it took a while, but we finally got approval, and we moved forward with that project about a year and a half, 2 years ago. And again, last year, we completed this project where we took our medical surgical unit and we completely renovated the entire unit. And I'm pretty sure people in the community were familiar, if they were in the hospital during that period, of all the construction that was going on and shuffling of rooms and beds and floors trying to accommodate that. But that project completed in the summer.
Right.
And now we have a brand new 31-bed medical surgical unit with all of the state-of-the-art amenities, beautiful hardwood floors, private bathrooms and showers. We converted, I believe, about 20 of the rooms into private rooms. And I know, people really aren't in favor of having roommates when they're not feeling well in a hospital. So the larger number of private rooms makes it better for the patients and families, and I think it's been working out really well.
And being a pediatrician who admits to that hospital, I mean, it truly is a gorgeous unit. And to have the families be able to stay right there and not have to worry about a roommate, I mean, we're very happy that that was the way in which it went.
Yeah, and we were very happy we got the funding to be able to do that. It took a while for the project, coordinating of the spaces and stuff. But at the end of the day, we pulled it all together. So now we're proud that unit is open and up and running.
Good. And let's hold that thought, and we'll be right back after this. Welcome back. We're here with Senior Vice President Jeff Reilly from Bon Secours Community Hospital. And we were just talking a little bit about the renovations to the medical surgical unit at the local hospital. So let's backtrack a little bit and talk about some of the services that the Bon Secours Community Hospital offers for our community, in case our listeners out there aren't aware.
So Bon Secours Community Hospital is pretty much your standard community-based hospital. We provide most of the standards of care that are available at most of the larger hospitals, and obviously we do not get into cardiac kind of cases and open heart and those kind of things. But we really do a really good job on the community-based kind of services. So we have a strong surgery department. We provide general surgery to our patients. We have a bariatric center of excellence. So we do a lot of bariatric surgery along with all the support services pre and post related to those types of surgeries, which are really good.
Which are much needed.
always needed. Bon Secours Community Hospital, like I said, has a 31-bed medical surgical unit. We have a telemetry unit where we can do cardiac monitoring. We have an ICU, 8-bed ICU. We also have mental health units on our facility. So we have a detox rehab unit and we have a mental health unit. There has been a lot of closure of mental health services across many of the states. New York not excluded, right? And so we're happy to say that a few years ago we expanded our mental health unit, and we continue to provide strong mental health services for the community. So that's worked out really well. And then, of course, our ED. We actually expanded our ED a little bit a few years ago and added a fast track unit. So the fast track really helped in throughput and reduced the amount of time that patients have to wait to be seen. And,
absolutely.
The treat and release times are way down. So that's worked out really well for us.
Good. And you see both adults as well as pediatrics in the ER.
Correct. And we have your support on those services,
absolutely.
which is great. So,
I just wanted to get the word out there because I have so many times where parents ask me, which hospital should I go to? Should I go to Orange Regional? So I always say, no, we still provide the pediatric services at Bon Secours. So I think a lot of people with the maternity ward closure, I don't think they really understood that it was just for OB. I think some families out there thought it was pediatrics as well.
Yeah,
so I just wanted...
We definitely continue to provide pediatric services, and we'll continue to do that going forward. So yes, if in fact, in the summer times, we get a lot of pediatric cases because of the camps and things that are happening in the community. So
and that's when most of the accidents happen is the summertime. So all those broken bones.
And we actually contract with a lot of the camps, to be able to provide those services. So it works out really well for us.
What an asset to the community. That's awesome. And so I know we partner together with MCHC and Bon Secours. So do you want to talk a little bit about that?
Yeah, we've been working with Middletown Community Healthcare for several years now. Several years ago, we turned over the federally qualified healthcare facility over to Middletown Community Healthcare to run. We felt that it was in the community's best interest that they could do it better than we could do it. And so we've been working very closely with them ever since, working on together to bring physician services to the community, pediatrics to the community, and all the support that they need. So we work very closely together. It's been great, and we're hoping that the relationship continues. It works out really well for us. Great.
That's very nice to hear. Now, before we end our segment, let's talk a little bit about the vision for the future for Bon Secours, if you will.
Well, I think the priority for us is my next major renovation that I would like to have happen at the hospital is to expand our emergency department. Mm-hmm. We see about 25,000 patients a year.
Wow.
We have
quite the volume.
Yeah, it is. Yeah. It's pretty amazing and growing every year.
And I feel like half of them are children with the amount of phone calls I get on a very regular basis. Yeah.
So for us, we need to enhance the emergency department. Mm-hmm. We need to expand it to be able to accommodate more of the treat and release kind of volume.
Right.
We'd like to create a more of a secluded area to deal with our mental health patients that are in crisis that come.
Right.
And just more space. We have, I think, about 11 rooms, give or take, in today's world for 25,000 patients. It's always tight.
Absolutely.
And so we're hoping as we move forward to work with the community and work with the government to see if we can get funding and be able to expand that emergency department. So that's one of our major visions moving forward. And then the other piece is to continue to try to recruit specialists into the market and provide outpatient surgery capabilities. The GYN is a nice addition for us.
No, absolutely.
We're going to continue to look, to add more GYN or more general surgery if we can. We recruited a orthopedic last year, and so our orthopedic surgery volumes have doubled.
Great.
At Bon Secours Community Hospital, which is really great.
And does that provider also see children as well?
I believe they do. I don't know his age limits on that. That's Dr. Manica, and of course Dr. Paserch has been in the community forever. So they do, I'm sure, see a certain number of pediatrics, but I can't really say.
I just figured I'd plug that, being the pediatrician that I am.
Yeah, you have to do that, right?
Of course.
And then besides general surgery, we'd like to continue to recruit other specialists. So, we continue to work with Middletown Community Healthcare and with the community on the needs of what, we need to provide here. And then, physician recruitment is tough.
Yeah.
Getting harder all the time.
Oh, I'm sure.
So we're working as hard as we can to bring specialists in to provide the services for the community.
Well, great. Well, thank you for providing that to our community. We really appreciate it. And I just want to say thank you again for being on our show, and we'll be right back after this. Welcome back. Now's the time in our show for our email question of the week. And this one comes to us from a worried dad. And he writes, "Help. It's wintertime, and my son has horrible dry skin. As a baby, he had eczema. He is complaining that it's itchy, and I'm so not sure what to do to help. Any suggestions?" Well, with the winter comes dry, itchy skin, especially if you've had a history of sensitive skin in the past. Once that cold air hits, even before the rash starts, immediately use a lotion or cream that is emollient-based to help as a barrier. Use this once to twice daily, depending on how dry the skin is. Also, you want to avoid daily hot baths for your little one. Use lukewarm water in the bath and only do so every 2 to 3 days to avoid drying out the skin further. If your child develops patches of intense redness with the itching, you can also add an over-the-counter hydrocortisone cream to the affected areas. But if it worsens despite all measures, have your little one see the pediatrician, as there are plenty of creams or ointments out there that can be prescribed to help calm the irritation. I hope this helps. For those of you with further email questions, please feel free to email me at drsara@middletownchc.org. Again, that's DRSARA@middletownchc.org. I would just like to thank Jeff Reilly for being with us today to discuss all that Bon Secours Community Hospital offers to our community, so thank you. I hope you have an active and healthy week ahead, and I'll see you again next time. Thank you.